So, Matthew, should we make a beginning?
Yeah. You want me to start?
Yes, please.
So, welcome to this Balint India session, where this is similar to the sessions that we did in the last 2 years. I think from 21, 22, 23, we've done sessions almost every year, basically to sensitize people about the Balint group and what the Balint group has been doing in India for the last 4 or 5 years. To this end, I think we've had a few of these introductory sessions, and there are a few groups that are running in the country following these sessions, and various people have expressed a desire to be part of these groups. So many of us, I think Arun, myself, and a few other people are running different groups, and we've been encouraging both consultants, faculty, whoever is doing therapy who wants to join these groups. And also recently we've introduced this to students, postgraduate students who want to join and be part of these groups. And so we basically want to sort of popularize this whole issue of Balint group discussions and make it part of the mental health training that we have in our country. So that's the whole purpose. And then I think the rest of the proceedings, I think Arun, you're going to talk about it.
So we started in 2021, September 14th, actually. I just looked up the date. And so we've been doing these.
2020, actually. 2020 September, during COVID.
So we started the group in 2020. The first event.
2020, yeah.
The first event was in 2021.
Ah, okay.
And then since then, I think we've sort of held yearly sessions. So most of these are pitched at the level for people who might know a bit about Balint or might not know anything about what Balint groups are. And today we have 3 people who will be speaking to us. So first we have Nishanth, who's a consultant psychiatrist in Australia, who is a part of our Balint Foundation. And then we have Dr. Veena Sathyanarayana, who is professor of clinical psychology, and who will be speaking to us. Additional professor. At NIMHANS, and will be speaking to us about where Balint is in India today and where we are heading. And then we will have Dr. Laksmi Siva, who's also a consultant psychiatrist, and will be speaking to us on Balint and psychotherapy. And then Dr. Shivakami, who is a consultant psychiatrist in Chennai, will lead a live Balint group. So that's in summary where we're headed today. And if any of you have any questions, please put them in the chat. I will be monitoring that, and Matthew and I will field the question answer session towards the end. So without much ado, without wasting too much time, welcome to the session today, and hope you all have lots of questions and that you have a good experience as well. So we'll head straight into the first session, which is Nishanth. So Nishanth, I'm going to spotlight you so that you can start to speak. And
so should I'll share the screen, right? Okay.
So Nishanth, tell us a couple of things about yourself before you start so that you can.
Okay. So hi, everyone. I hope you can see the screen.
Yes.
Yeah, hi. So yeah, hi, I am Nishanth Jarajan. I'm basically from Kerala. I trained in NIMHANS, and it's great to see so many people, from they're here. And I've been in Australia for around 10 years, involved in Balint work for 8 or 9 years now. And I'm part of the society here and run groups here. So yeah, what else? I'm primarily an adult psychiatrist. I work in eating disorders and adult outpatients. And I'm really delighted to be part of the Balint India Foundation. I joined only this year, and I'm kind of trying to see how I fit in the whole picture. So with that in mind, can I begin, sir?
Of course.
Sure. So, so I'll be giving a very brief history of Balint groups and concepts about their relevance in psychiatric training. So as most of you would be aware, they're named after Michael Balint, who's pictured here with his wife, Enid Balint. And there is this famous quote that is attributed to him that at the center of medicine, there is always a human relationship between a patient and a doctor. And as you know, all relationships come with a baggage. And a Balint group is like a dedicated space to lighten this burden. So it's interesting to know how this transformative idea evolved over time. So Michael was the son of an Hungarian Jewish general practitioner. So after sustaining an injury during World War I, he actually left medicine. He was studying medicine at that time, and he later pursued studies in biochemistry and psychoanalysis in Berlin. And he was a member of the influential Budapest psychoanalytical school, and mainly seen as a proponent of the soft object relations theory, in the sense that it's not reality as such that matters, but a perception of reality. So he, because of the rise of the Nazis, he had to flee Hungary, and he went to England. And unfortunately, his parents, who stayed back in Hungary, they completed suicide because they wanted to prevent, being arrested by the Nazis. So in this traumatic backdrop of a World War II, Balint kind of turned his psychoanalytical focus on the doctor-patient relationship. So in 1950, alongside Enid Balint, he established the first Balint group at the Tavistock Institute in London. And they had a group of 8 to 12 doctors, general practitioners, and the 2 leaders, and they were meeting weekly for around 2 years or so. And this idea kind of spread across countries and specialities. And Balint kind of further solidified his legacy through his very influential 1957 book called The Doctor, His Patient, and the Illness, which many of you might have read. So the question is, how does this relate to our daily practice? So one way to grasp the value of a Balint group is through the concept of a group mind. So one of the definitions of intelligence is that it's the ability to see reality through multiple perspectives. So all of us see the same scenario through our own perspective, which is shaped by our life experiences and the way we think. So in a Balint group, each member, shaped by their own unique background and life experiences, contributes a distinct viewpoint to the discussion. And this diversity enriches the understanding of the case and proves insights that all of us on our own may take years to achieve, or sometimes they might never emerge on their own. So in a group, we can traverse great distances. And to understand this concept better, you can imagine a simple diagram which connects the mind, the body, and the world. So we live in a world where we perceive it through our senses, our eyes, our ears, our skin, and so on. And these sensory inputs trigger emotions and thoughts which guide our actions through our body. In our day-to-day clinical practice, our world is a patient who presents with the symptoms that stimulate our senses and evokes emotions and thoughts. However, in a fast-paced clinic environment, there is really little time to kind of delve into this, and we kind of repress these feelings. And we quickly have to shift to pattern recognition, making a diagnosis, planning, management, and going to the next patient. So in a Balint group, this entire focus of the management is taken away. So in this setting, the world is the patient-doctor interaction, or the case, as we call it, that a member presents. So unlike in clinical practice, there is no real space for clinical decision making in a Balint group. Instead, the group focuses on the various other parts, like the emotions that it brought up, what are the body sensations, what are the thoughts, what are the images, what are the fantasies, what are the memories that were triggered as you listened to this case. So essentially, the group provides a very confidential and safe space to explore and share these often complex and difficult emotions. And this approach is markedly different from our day-to-day clinical practice, which emphasizes convergent thinking. We have to converge to a solution, to a diagnosis, to a treatment plan in a very limited time. Whereas in a Balint group, we are actually diverging, opening up possibilities and exploring a wide range of emotional responses. So how can we make use of this unique form of a group in our day-to-day clinical work? So burnout has been a significant issue worldwide. In fact, there was a recent survey in February among the Australian psychiatry registrars residents, and apparently 90% of them reported symptoms of burnout. So that's a very huge number. The Balint Groups offers a very safe space to reduce stress and address countertransference. And sometimes it's just really a laboratory for us to practice mindfulness. Sometimes attend a group simply to lighten a burden, while at other times I feel like you can actually see how a case triggers changes in your body. Sometimes there may be tingling in the hands, or your tummy rumbling and things like that. So while a Balint group isn't technically therapy, it serves as a valuable resource for deepening one's understanding of psychodynamics as well. And that's why Balint groups have become an integral part of various training programs. So for example, in the UK, participation in Balint groups is mandatory in psychiatry training. And in psychotherapy training, this comes under case-based discussions, or Balint groups, which are done weekly to fortnightly for a year. And in the United States, various medical schools incorporate Balint groups into the curriculum in specialties such as family medicine and psychiatry. In Australia and various other countries, there's no formal incorporation into training, but there are various societies and independent Balint leaders who run groups for students and healthcare professionals. But essentially, the poster child for Balint group training in medical school is Germany, which has incorporated this into training since 1987. And this is across different specialties such as gynecology, psychiatry, general practice, etc. And in fact, in Germany, insurance companies pay more if a doctor is engaged in Balint training. So this is similar to how certain healthcare funds, they provide incentives or reduce premiums if you exercise regularly or go to a gym regularly in the hope that you will fall sick less often. So similarly, ongoing participation in a Balint group is conceptualized as a way of reducing your risk of burnout and improving your productivity. So I'll conclude with acknowledgements, and I will share a video from Dr. Heidi Otten, who's a very influential Balint leader based in Germany. She's also in the organizing committee for the Ascona Prize essay competition, which is a prize for medical students who write essays on the student-patient relationship. So Dr. Otten will share her thoughts about her Balint journey.
Hello, Balint India. My name is Heidi Otten. Greetings to you from Germany. I'm in Balint work since more than 40 years. I started as a young GP to attend a Balint group. Later, I was the secretary of the German Balint Society and the president of the International Balint Federation. And I have been training Balint group leaders for many years. What is so fascinating about Balint work? A group of medical professionals meeting, listening to each other, to problems, to ideas about patients, to fantasies and stories with empathy. It has helped me as a young GP to understand, to share uncertainty, to gain confidence. I was not alone with my worries. In Germany, we hear more about aggressive patients lately, attacking doctors. It became an everyday problem. We have to deal with it. Sometimes it is worth looking what's behind this behavior. Balint work is an analytical method. We try to understand the action and of the patient and our reaction. My experience in all these years with medical doctors all over the world has been that Balint work is a great opportunity to exchange thoughts, to get support in our daily work, and to preserve our well-being. All the best for you. Bye-bye.
Thank you, sir. So I think that ends the first presentation.
Okay. Thank you, Nishanth. So I think we will now go into the second one, which is Dr. Veena Sathyanarayana, who is going to be, I will spotlight you, Veena, so that you can, we'll take questions towards the end so that we can, have all three speakers answering the questions. Are you okay sharing your slides, Veena?
Yes, yeah. So
Yeah.
are you able to see my slides?
Yes.
Okay. So good evening. Nice to connect with all of you. Like Dr. Arun introduced
Put it
me.
on a slide format, presentation format, Veena.
Sure. Yeah.
You're on the last slide, I think. Go to the
So
first
is
slide.
it okay? I'm on the first slide.
Yes, you can see
Okay.
it.
The Balint experience in India now and the road ahead. Yeah. Okay.
Yeah. Okay, so like Dr. Arun kindly introduced me, I'm Veena. I'm an additional professor in the Department of Clinical Psychology at NIMHANS. So the way I got introduced to Balint Group is all thanks to Dr. Matthew Verghese when I joined NIMHANS as a faculty. He got a few of us together to participate in some of these groups. And of course, the COVID times provided a window of opportunity for a lot of online teaching and training programs, and Balint groups were no exception. So at that time, Dr. Arun Kishore was offering a lot of these groups online. So why are we talking about the Balint experience in India? It is because, like they've rightly pointed out, it has quite a brief history compared to other countries, like Nishanth also pointed out in his presentation. So although the start has been slow, it has been fairly steady from the time that the Balint groups have started. So in the mental health profession domain, there is a lack of psychotherapy training programs. It's not that Balint groups are relevant only to psychotherapists or to mental health professionals. It is something that is relevant for all of healthcare. And I think to develop the ability to be therapeutic, reflective, use one's reflexivity, become self-aware is something that's likely to be relevant for everybody practicing any form of healthcare, but more so for mental health professionals because they're working very closely with patients and, obviously the optics of the mind and behavior. So a lot of Balint training in India started with psychiatrists in practice. A lot of groups were being offered both online as well as offline. Subsequently, this expanded to residents in training, particularly in psychiatry, clinical psychology, psychiatric social work, and also a few nurses, both in training as well as in practice. So there's a little experience, a pilot project, which was supported by the Kerala State IPS, where psychiatry teachers across medical colleges were trained in running their own Balint group. So subsequently, once people had the experience of participating in these groups, they went ahead and started receiving supervision to become facilitators and leaders of their own groups. So talking about the road ahead, I think we all envisage that through the Balint India Foundation, we continue to create interest in experiencing some of these Balint groups, spreading the word. A lot of us that are going to be speakers today have experienced these groups. The reason we are here is also because we found a lot of value in participating in these groups. It's enriched our practice. We've tried to offer our own groups with the students that we teach and we engage with in our own institutes, as well as practitioners outside. We recognize that a lot of people who participated in these groups have also given feedback that it has, definitely informed their practice in many ways. And so we thought that through the Balint India Foundation, it would be very important for us to continue making these efforts to spread the word around, get more people interested, both to participate in these groups, but also definitely to become facilitators and leaders who can run their own Balint groups in their own settings, both in public practice, private practice, in the various states. India is a big country. We really need to get the word around to different states and regions of India. Nishanth mentioned that it's already part of curriculum in several countries, but it is still not so in India. So that could also be an opportunity, and there are, people in positions of power who can be influenced to integrate this into curriculum, let's say, for training of psychiatrists, clinical psychologists, psychiatric social work professionals, and also nurses to begin with. But of course, like many people have already pointed out, Balint is not just about mental health and psychiatry and psychotherapy. This is something relevant for all of healthcare professions. So the ultimate step is to really also scale it up to other healthcare professions. So I just have 2 slides. I think that's a testament to the brief history of Balint groups in India. But I'm happy to answer questions in the end. And of course, I'm sure Dr. Arun Kishore and Dr. Matthew Verghese have a lot more to say. Thank you.
Thank you, Veena. You might need to end your sharing your slides.
Yeah.
So thank you, Veena. And like you said, a brief history, because just been 4 years down the line. So and now much right. So Lakshmi, it's your turn now. Would you tell us about psychotherapy and Balint?
Yeah, I just share my screens.
Tell us a bit about yourself, and if you can make a beginning, that'd be great.
Yeah. Is my screen visible?
Yes, it's. Could you make it into a slideshow? Thank you.
Right. Yeah. Yeah. Hi, I'm Dr. Laksmi. I did my training psychiatry in NIMHANS and currently working as a private practitioner in Bangalore. I have been in the Balint group in the, I think, last 1.5 to 2 years. And I'm happy to be here to talk about something that I have read about and learned from seniors over here. So I would be talking about what are the key differences between psychotherapy supervision and Balint groups, and what is the importance or why Balint groups have to be included in psychotherapy training, what are the benefits and challenges in implementation. So just with a very brief introduction, we know that, with the advent or focus of more on biological psychiatry, we are trying to find idiopathogenesis in terms of genetics, neurobiology, and with all the investigations on EEG, MRI, and all those things, we feel that psychotherapy training especially is sort of losing its place as compared to the previous times. When we see doctor-patient relationships, there was a time where doctors were compared to be, godly, whereas now it's almost become like a consumer and a provider kind of relationship. And that brings us to the importance of providing a structured or classical psychotherapy training to students. When I say doctors or residents, I don't mean only medical students. I also mean to include all the specialty training students. And like the previous speakers have said, it need not be restricted to mental health too. So there is a need to revoke classical psychotherapy training, and we'll try and understand how Balint groups can serve this purpose. So how are they different from the routine psychotherapy supervision? In Balint groups, the emphasis is more on self-awareness, empathy, and navigating complex interpersonal dynamics in context to the patient care. Whereas in a psychotherapy training or a supervision kind of programs, the focus is more on acquiring clinical knowledge, technical skills, and engaging in long-term therapeutic relationship with patients. Balint groups rely more on reflective format, exploring the emotional and relational aspects, whereas psychotherapy supervision takes a more didactic approach and emphasis on theoretical concepts or evidence-based interventions. Balint groups foster a more peer-to-peer learning, whereas in psychotherapy training, it involves a higher degree of structured supervision, where the trainees can actually get direct feedback and guidance about a particular case from experienced clinicians. So Balint groups, it's not a forum to make decisions about any individual patient's care, whereas in psychotherapy training, we do get that. So why Balint groups in psychotherapy training? They can enhance self-awareness and empathy, clinical skills beyond theoretical knowledge. They can bridge the classroom learning to the real-world application. The understanding of the doctor-client therapeutic relationship can be enhanced through Balint groups. The students are probably able to recognize concepts such as transference and countertransference by participating in groups. And the essence is reflective practice and enabling students to have, more of critical thinking. So the is where students can talk about their anxieties and uncertainties without fear of judgment. It enhances students' ability to empathize with patients. Balint groups can prepare students for the real-life challenges in clinical settings. And they can also help managing their own emotional toll or the risk of burnout, like how Dr. Nishanth was mentioning. I'm not going into detail of the process of a Balint group session. By and large, we know that it involves a case presentation, there's a group discussion, and there's a facilitator who will guide the group. So if we want to integrate Balint group programs in groups in either residency programs or other training programs, student training programs, what should we do? There should be clear guidelines established and expectations for participation should be set, including the importance of confidentiality and active engagement. Facilitators who are experienced should be identified, those who can lead the group discussions. Allocate dedicated time within the residency curriculum for regularly scheduling the Balint group meetings. Residents should be encouraged to actively participate and share their experiences. Finally, we may also consider, in case these are incorporated to an extent that we are imagining, then we may also consider Balint group participation into evaluation of residents or other trainee programs too. When I said I don't mean to, talk only about psychiatry residents, by including a diverse range of healthcare providers like social workers, psychologists, or other allied health professionals, it can give a more holistic understanding of the patient experience, and we can also understand the various perspectives that are involved in patient care, promotes greater collaboration and communication between the disciplines. Group members learn to appreciate the challenges of their colleagues and perspectives of their colleagues. And this will ultimately align with the growing emphasis on interprofessional education and practice. What are the challenges? If we think of introducing this in psychotherapy training programs, the challenges, main two challenges are, one, the kind of physician-patient or the therapist and the client kind of relationship here may not align as seamlessly with the more in-depth long-term relationships that characterize psychotherapy. Second, trainees may be more inclined to focus on the acquisition of knowledge, technical skills, rather than the reflective practice emphasized in Balint groups. Students may feel anxious about or they may struggle with the emotional intensity of discussions that it sometimes can happen in challenging cases. The success of running a Balint group also depends on the facilitator's ability to manage group dynamics. And of course, there are logistic challenges given that there is a curriculum, they have to manage the hours, there is inpatient care, outpatient care. So with all those things, logistical challenges of fitting this into the existing training schedules is something that we need to think about. Way forward, I would say that explore the benefits of Balint groups for interprofessional teams, greater collaboration and understanding across disciplines. It should spread across all, all areas of medical fields, just not in psychiatry, or just not even only for trainees, maybe even for practicing clinicians. Evaluating the long-term impact of Balint group participation, and integrating Balint groups along with other emerging approaches in terms of resilience training, mindfulness, or other interventions to ultimately enhance clinicians' well-being. So yeah, that's all what I had to present. Thank you. If there are any questions, I will take it.
Thank you, Laksmi. We will, if you can, yes. So I will now open the session out for questions. If any of the participants have any questions, just unmute yourself and ask. We're a small group, so we can be informal about that.
Hi, this is Shiv Prakash here. I do apologize, my video isn't on right now, but as long as I'm audible, I'd just like to continue with my question.
We can hear you.
This is a little bit perfect, thank you. So any one of the speakers or the organizers can basically help me understand like a few things about the nitty-gritty of the running a Balint group. First thing I'd like to understand is, since this is for healthcare professionals, is it an open group? As in, do you have an option of walking in when you have an opportunity to walk in? Or is this more like a closed, regular, show up and mark your attendance sort of a group? So that's number one. And this is especially true when we are talking about professionals like residents, because they might be on duty, they might be post-call. And if you're including other staff members like nurses, I seriously think that it might be a little bit of a challenge. And the second question that I had, are there any ground rules before we get into the actual Balint session of today that I should be aware of?
Thank you, Prakash. And I'd invite one of the three speakers to respond to this. And I guess there are two sides to the question. One is what is recommended in terms of practice, and I'd also like the speakers to respond to what actually happens in terms of how groups are run. Just your experiences in doing that, and perhaps
I think. Yeah, I think that's a very important question, because if you look at Balint research, there is not a lot of research on what we call modified Balint groups, because what you're asking is whether you can do one group and then, forget, or will that itself be helpful, or do you have to be in a group for a period of time? So, so there are various forms of Balint across countries. There is classic Balint, wherein you'll be in the same group over years, the same amount of people. So group dynamics develop over time. So the more time you're in a group, the higher the safety that you'll feel, and the more you'll open up. But as you rightly pointed out, it's not practical in all our settings. So there's a lot of experimentation with what we call modified Balint groups or open Balint groups, wherein, different people come in and go. And those still have got some preliminary evidence in terms of, helping. And I think all of us have anecdotal evidence that, people feel better, they feel listened to, they feel that their concerns were validated after they do that.
Veena, Shivkami, or would or Lakshmi, would you like to respond? Especially, what's your experience in India running groups?
Yes, so can I go?
Yes, of course.
Yeah. So I think what I want to say about the Balint group is it should not, and it's not supposed to become one additional activity for residents or practitioners to participate in the sense that it should not add to the already existing strain in terms of the investment of time, in terms of the effort and all of that. This is supposed to be an experience, and people have mentioned in their presentation also that, people look forward to being in these groups only because it takes away the stress and strain, and also people experience a lot of relief from stress and burnout. I do understand one of the logistic issues here in India is also because people are overworked and people are working 6 days a week. They work long hours. Making time to be part of these groups, I think, is a little bit of a logistic barrier. But once people have experienced this group, I feel that people are willing to make that time to be a part of these groups. May not happen at, let's say, a weekly frequency, but at least once in a month, people look forward to being in these groups. I think it's easier to start early, and I found that, the advantage with residents is that in many ways they are like a captive, population, which is good and bad. But I think it's good to start early so that they introduced to the Balint groups early, and then they can decide at what frequency they can afford, depending on the various settings that people these days practice in, to see how they can take it forward in their own careers. So I think it also offers that amount of flexibility, which I think is good. I think also with the online platforms being used so effectively, that again becomes a big strength. To a particular place is just impossible. So I think those are some thoughts.
We have one more question, unless Shivkami or Lakshmi want to respond to this. So we have a question, Dr. Vasudeva, I'll come to you in a minute. I know you've got your mic unmuted. I will come to you in a minute after this second question. So Ipsita Basu asks, thank you for this enlightening introduction. Wanted to ask, what exactly is the format of a Balint group, especially for the case presentation and discussion?
I think once we show a live demonstration, you might have better answers than explaining that here. But just to say that there's no very specific format like how you want you present in, say, in your residency programs or training programs, that you don't have to go in a particular order under specific headings or things like that. Because it's more to do with the therapeutic relationship rather than what the case is per se, or in terms of understanding what are the clinical challenges, how to treat that particular patient. We are not talking more on that, right? I think if you participate a couple of times, you'll get to know.
Thank you, Lakshmi. So Vasudev, did you want to ask your question?
Yeah, I thank you. Good evening, and thanks, Arun sir, for asking me directly. I wanted to share my experience. I have been there for a couple of months, and I have still not managed to present a case yet. But I want to admit and appreciate that the attending the group was actually giving me insights about myself about the inner compulsion to find positive change in the patient, otherwise developing a negative countertransference toward the patient. And the pacifying influence of the group actually helped me I realized that my expectation of recovery, it turns gradually into a demand, and if it is not fulfilled, then I tend to get angry. So it was very useful for me. It has acted as a nice, timely speed breaker. I at times have found that the time allotted to present the case or to discuss the case uh, remains a little less. But then I have seen the group being flexible and extending it into the next session. So I believe it is a very nice activity that is therapeutic for the therapist. So who will rescue the rescuer? Balint will rescue the rescuer. That was the answer that I would give. Otherwise, Nishanth was quite warning, cautioning that we are also seeing more and more patients getting angrier, and they may become aggressive, like Dr. Nishanth mentioned. So I believe it will be necessary for us, and I found that expressing our own subjective feelings, as it is more attuned to the tenets of cultural psychiatry also, that also makes it more plausible and to fall in line with what I have been learning and working on. Thank you. These were a couple of observations and comments that I had. Thank you.
We have one more question. Yukami, is it time for us to start the group, or do you think we can take one more question?
Yeah, actually, I was just wondering. So how I realized I didn't confirm how much time we have for the group, really.
So it would be 45 minutes, so that we finish in another 45 minutes.
Yeah, so I think maybe we should make a start
Okay.
if we have only 45 minutes left. And I think Dr. Shivprakash is just wondering about ground rules. I think he asked that one question. So I was wondering whether just watching the Balint group might in itself answer that question. And maybe we can go back to that after we do the demonstration.
Yes, and he's also asked about what to avoid. So perhaps we can go into the Balint group. What I will do is I'll stop the recording so that we do not record the Balint group as such, which is one of the rules. Because of confidentiality, we don't have a recording of